Hey, my name is Dr. Brad Glowacki. I'm a chiropractor, and what you're about to see is some of the adjustive techniques I've used on three-time Olympic gold medalist Misty-May Treanor. She had her Achilles torn and surgically repaired. She had done a bunch of rehab, and when she came to my practice, she still had some joint motion and things that weren't quite right from a chiropractic perspective. So you'll get to see that in a moment, but I just want to say she's got a phenomenal surgeon. She's got a phenomenal health team around her. What I do in my practice and then what I teach other doctors are these kinds of techniques, and then also how to communicate that so that the patient effectively knows what's going on, because if the patient and the doctor are moving in the same direction, you can achieve great results provided you know exactly what you're doing. And that's what we teach in this video too. It's intended for other doctors, but I think you'll enjoy the specificity of it. And on a personal note, I want to say Misty-May Treanor is the most phenomenal person on a personal level. She's awesome, but you'll love this adjusting technique, and the specific hand placements really are what ensure results for any person, but specifically elite athletes. All right, Doc, so we are going to check out some extremities and do some extremity adjustments. This is Misty, and one of the things that she's had in her history is a blown Achilles. So she's had an Achilles on her left side that's been surgically repaired, completely rehabbed, but her right ankle has given her problems. So usually what we'll do with our adjusting is we'll go spine first, look at her lower back, work through the spine, but she's had some problems over time that have really given her issues in here. When we do the evaluation, I'll always palpate and feel for the motion. Real obvious that she's got an inversion and her calcaneus is basically medially listed, and as I palpate the internal side of it, she's also superior listed on the calcaneus. So when we adjust it supine, what I'll do is I'll lock in the talus with my right hand and I'll dorsiflex that, and then we'll take the calcaneus, and because it's medially listed and superior, I'm going to do an inversion, an eversion. I'm going to pull and distract at the same time, but we're going to lock that as we do so. So basically I'll lock the talus with my right hand, I'm coming on her right ankle with my left, and basically as I get it there, it's a little tender, we just clear that straight out, and as it does that, it's going to restore the motion in that side. Because she's had a surgically repaired Achilles, the motion on this side, sometimes when she gets locked up here, it's usually just a straight distraction of the mortise, and she's done repetitive motions that have kind of recreated that. So what we do is just clear that straight out. What I'll have you do, Missy, is just go face down for me if you wouldn't mind. And you can see the Achilles surgery, and they did a great job with that, but a lot of times when we look at the evaluation here, she's really straight. The calcaneus doesn't move too much, but if I have any problems, it's with her cuboid, and so I'll either do a straight distraction or we'll set up on the cuboid. So there you have it. The hand placements on extremities is always important. With a number of bones, whether it's foot or the carpal bones of the hand, you really need to palpate. We didn't have time to show all the checking and rechecking, so I just want to emphasize that at the end of the video, is that hand placements and palpation, just to not drag out the video, is really key. I've taught this information for CE credit for state associations within chiropractic. We've got a number of pro and Olympic athletes, and I'll tell you, a lot of the best work in chiropractic is sometimes off the spine on extremities for their performance, and I'm sure Misty-May Treanor would tell you exactly the same. And if I didn't mention it already, just want to reiterate, as a person and you know, a human being, she is someone that you can definitely have your children look up to as a mentor, because she's such a quality person inside and out. And I know sometimes we don't see the best of people on news and ESPN, but she is one that is a one in a million, lives a healthy lifestyle, exudes it, and she should have a following because she is just such a quality person.